What about personal social? In a 6-month-old, this is a baby who will work for a toy. Kind of like we'll work for food. A 6-month-old will work for a toy. They see it, they want it, and they'll go after it. They smile often and they interact with their caregiver. And for caregivers, this is a fun time with their 6-month-old. With regard to language, in a 6-month-old, they squeal a lot, which sometimes means that they're happy, but it doesn't have to mean that. They're listening and observing their own voice. They'll turn toward a rattling sound. So again, they're very interactive with their environment. And it's very, very fun for the adults who are around them. What about the reflexes in a 6-month-old? You remember the Lucky 13 I talked to you about? Those reflexes begin to drop off at 2 to 3 months, 4 months, but by 6 months of age, the 13 reflexes that you checked that were present at birth normally have begun to disappear. So at or by 6 months of age, those reflexes are no longer present. And I've listed some of them for you. Some of them never disappear. And one of the reflexes that never disappears is something called the parachute reflex. It's a reflex that occurs when an infant extends their arms and hands and fingers. You'll do it too. When suspended prone and lowered quickly toward a table. It's the same reflex that people have when they parachute. So it's called the parachute reflex. What about the fontanelles in a 6-month-old? One more time, anterior is open. It better be open. If it's not open, it's always an urgent referral. Here's another question. And it's a question because it's a really important event. The question says, at what age should eye alignment occur? Well, remember we were talking about a disconjugate gaze always at 2 months, sometimes at 4 months, but by 6 months of age, the eyes should now be aligned. At 6 months of age, you should not have disconjugate gaze. And so, if you're watching closely, the disconjugate gaze should be absent. If it's present at 6 months of age, an ophthalmology referral is always in urgent order. Speaking of the eyes and the conjugate gaze, a 6-month-old is going to watch his own hands. They're going to reach toward and grasp hanging objects. And it's interesting to note that while most mobiles are black and white, because infants only see black and white colors, at about 5 months of age, the rods and cones in the eyes now begin to get developed and active. And so infants now begin to sense color vision at about 5 months of age. And that brings up vision screening. Because so much of your environment is taken in by seeing, vision screening is very, very important. There are 2 words you gotta know. The first one is strabismus, and the second word is amblyopia. Amblyopia refers to a loss of vision, and the most common cause of amblyopia is strabismus. What is that? I don't know when the last time is you thought about this, but when you look at something, both of your eyes focus on the same object at the same time. When that doesn't occur, in other words, one eye looks at one thing and the other eye looks at something else, when that happens, your brain gets 2 sets of information. It doesn't know which one to pay attention to, and so the brain selectively ignores information from one of the eyes. That leads to a loss of vision in that eye. That loss of vision is called amblyopia. So as you assess children's vision, what we always look for is strabismus. It's the most common cause of vision problems in children. So how often does it happen? About 1 to 3 out of every 100 children has strabismus. Now, it develops sometime in infancy, but it can develop later than that. It might develop in a 3-year-old, a 4-year-old, which is why we always assess for strabismus, not just starting in infancy, but up to the age of 7 years. And so, if there's a family history of strabismus, it's something that you're going to assess for much later, up to age 7 years. And again, always needs ophthalmology referral. I have another question for you. So here it is. What test is used to assess for strabismus? Since I told you you're going to be assessing for it. The test that we use to assess for strabismus is the cover-uncover test. And let me make sure you remember what it is. I have it on the next slide with an image for you. The cover-uncover test is just what it says. We cover an eye and we wait at least 3 seconds and then we uncover. When strabismus is present in the covered eye, when it's immediately uncovered, the eye will deviate from the view. And so that's a clue to us that strabismus is probably present. And if you look at the image, you'll see the eyes are focusing on 2 different objects. Always a red flag and always needs ophthalmology referral. So that covers it for a 6-month-old. What about a 9-month-old? I want you to look at my image. Do you see what good control this 9-month-old has of his torso? You can see he's got good control of his hands. So let's look at growth in a 9-month-old. It's about as rapid as it was for a 6-month-old, which means their length increases by about 1/2 inch per month. Their weight increases by about 1 ounce per day, and the head circumference is slowed down as well. It's about 1/4 inch per month. Now, with regard to gross and fine motor skills, what can a 9-month-old do? A 9-month-old can pull to sit. There's absolutely no head lag. They sit without support. They crawl, they creep, they scoot, they hold to stand. They look for yarn. That's one of the developmental findings. Another one of those is they rake, and that's a term that's used. They rake a raisin with their fingers, and they can pass a cube from one hand to another. Sometimes you'll hear these 3 words associated with the movement of a 9-month-old. The 3 words are creep, crawl, and scoot, which for you, as far as anticipatory guidance, it's critically important at that 6-month visit to make sure that the caregiver has a home child-proofed, because not only do things go right into their mouth, but they now have become very, very active. I want you to look at my next image. This is not really a 9-month-old walking independently, but this is a 9-month-old who's bearing weight on both feet, and they think they're walking. And as soon as that adult takes their hands away from the hands of the 9-month-old, he'll suddenly realize he's by himself and he'll fall. As long as he's got some assistance, he will think and it'll appear well that he is walking. So, common event in a 9-month-old. They pull to stand, they bang and they shake objects, they feed themselves with their fingers because now they've got good hand-mouth coordination. With regard to personal social in a 9-month-old, stranger anxiety develops now. So this is a time where they may have been okay being left with a babysitter or a family member, but now stranger anxiety may creep in. So look for that. What about language in a 9-month-old? Well, they turn toward voice, which assures you too that they can hear, but they typically use single syllables. They imitate the speech sounds that they hear, and they'll try to repeat them, which is why it's always important to be very careful what caregivers say around this age group, because they'll repeat it. The fontanelles, well, the posterior almost always is closed at this time, and it probably ought to be. The anterior should still be open, but if it's beginning to close at 9 months of age, that still is considered normal. The visual behavior of a 9-month-old, 9-month-olds are very interested in pictures, and so picture books for them usually are of great interest. They recognize a partially hidden object. But remember, at 9 months of age, out of sight, out of mind. So it has to be partially hidden. That wraps up what we know about 9-month-olds. The last part of infancy is the 12-month-old. And I want you to look at my image. This 12-month-old has his feet spaced away, which stabilizes his standing, because this is the time at which we expect him to be able to stand. They can pull to stand. They bang blocks together. At this age, about a year of age, they generally have a vocabulary of about 2 to 4 words. They feed themselves, they drink from a cup very easily. What about their growth? Well, growth now is cut about half of what it was in that 6 and 9 month period. So the rate of growth is slowing. They now grow about 1/4 of an inch per year. Their weight increase slows down quite a bit, and the brain begins to grow a little more slowly. So head circumference increases by about an inch in a year. So that's typical of a 12-month-old's growth. What about a 12-month-old's gross and fine motor skills? Well, you saw my image. They pull to stand. They can stand in about 2 seconds, which means they move quickly. They take 2 cubes. Now they're beginning to develop good fine motor skills, and they'll have pincer movements. So their thumb and finger grasp really begins to develop. But again, they'll take 2 cubes and they'll bang them together. With regard to personal social, the most characteristic of this is pat a cake. This is a 12-month-old's dream. And here's what happens. A lot of interaction takes place with the simple game that you know is pat a cake. Think about it. The baby has to interact with a human. He's smiling. He's coordinating his hands. He's verbalizing. And he knows what's coming next. This is a very, very busy activity for a 12-month-old. And again, with regard to personal social, that's what we expect. What about language? A 12-month-old is saying things like dada, mama. They're beginning to combine syllables, and their language is really now going to begin to take off. With regard to the fontanelles in a 12-month-old, the anterior is often open, that's normal. If it's closed, that's normal too. A 12-month-old in visual behavior, well, they look through a window because now their vision is much better. They recognize people. They recognize pictures. And so they have reactions to people that they know, and they have the same kind of reaction, or the opposite one, I should say. They have the opposite reaction around people that they don't know. Think about it. In the line at a store, or in church, or in a crowd, babies will stare at an unthreatening looking person. So they can have really, really intense visual observation or behavior with people that they don't know. Well, that wraps up what we know about a 1-year-old. We're about to make a big change because after 1 year of age, the baby now has a new name. The new name that we give a baby older than 12 months of age, starting at about 15 months, all the way up to 24 months of age, is toddler. And I want you to note that what we assess has changed a little bit. We're still going to look for gross and fine motor skills, but instead of personal social, you know what we're going to look for? Psychosocial emotional. So we no longer assess personal social. Instead, we assess psychosocial emotional. We still look at language. We still look for reflexes. We're still going to look at fontanelles, although normally they're beginning to close if they haven't already. And we'll look at visual acuity now instead of visual behavior. So let's get going with a toddler. The 5 or 6 things that we're going to assess, I have listed for you, and I want you to review them because this is what you're going to use when you assess this age, 15 months all the way up to 24 months. Now, it's most helpful when you examine these children to look at a 15-month-old, an 18-month-old, a 24-month-old. Those are the 3 times that you're going to interact on a routine visit with a toddler. So let's look at the chart. I want you to look at it vertically, not horizontally. So let's look at gross motor first. At 15 months, with regard to gross motor, a 15-month-old ought to be able to stand alone. They can stoop and they can recover well. They can walk well. 3 months later, by 18 months, they should be able to walk backwards. And by 2 years of age, a 2-year-old can run. They walk up steps, and if you ask them to kick a ball, they can kick a ball forward. If you were to ask an 18-month-old to kick a ball, most will kick at it and fall down. So in just 6 months, between 18 months and 24, they're able to kick a ball and the ball moves forward. That's gross motor. What about fine motor? In toddlers, again, I want you to look at this in a vertical manner. With regard to fine motor skills, a 15-month-old can put a block in a cup. By 18 months, they can scribble, but this is usually how they hold the pen or the pencil or crayon that you give them. They'll hold it like this, but they scribble. They can build a tower of 2 cubes. By 24 months, their tower can now be 4 cubes. They'll dump a raisin if it's demonstrated to them. So again, their fine motor skills, you should see maturation at every time period. With regard to psychosocial and emotional, a 15-month-old will wave bye. They'll indicate their wants and make their wants known. But by 18 months, an 18-month-old now plays with an examiner. They interact with them, especially with a ball. They'll imitate activities, and they can drink from a cup when they're 18 months. By 24 months, they usually are able to use a spoon. They take their clothes off, and if you give them a doll and a spoon, they'll attempt to, again, mimic that behavior. Look at language for a toddler. In a 15-month-old, they're usually able to say dada and mama, and they generally say about 1 word. By 18 months of age, they now say 2 to 3 words. So let's stop for a second because I want to make sure you get this point. I want you to feel comfortable in using your own children to help you remember what happens at what time frame. But I also want you to remember that your own children are going to be way smarter than the average child. For you to have obtained this level of education, you're at the tip of the pyramid. You're very, very smart. Consequently, your children are going to be smart as well. So these achievements represent the minimal achievement that we expect at these age time frames. Your children will probably, with regard to cognition and language, your children will probably exceed these time frames. So that's just a point of warning to you. These represent minimal achievements. So language, an 18-month-old, 2 to 3 words, 2 years of age, probably 6 words. They'll point to pictures. Your children will do a lot more than that, I bet.